Sir, please. Remesh Heta doesn't need any introduction. He's put Tiruvalla on the map of India. Yes, he is giving a great performance. Thank you. Thank you. Please, stage is yours. We welcome President-elect of CAP for the year 2021-2022, Dr. Ramesh Kumar, who single-handedly brought back South India roaring into the national scene. Thank you, sir. Looking forward to your presidency.
Green. Thank you, Chairperson, and my dear friend and the most vibrant Dr. Ashwath. And in fact, it was a great pleasure listening to you. I am so happy that I came an hour early and I was spellbound listening to you. And you are so charming and you are put so humorous at the same time. The scientific content was really good. And the crowd here and the participation really speaks for how anticipation is there for much for you. So a big round of applause for Dr. Ashwath, that he made it so vibrant and great. Well, good evening, and Chairperson and senior, my IAPNs, my academicians, my great friends out here. I can see right now here, Dr. Ramachandran and Dr. Tangavelu was here, Dr. Srinivasan sir, the teacher of teachers, and Dr. Neminathan, Dr. All my dears, as well as I can see a lot of my dear friends, and thanks to Dr. Dashayani also, and from the Combias desk. So, well, I'm so happy to be there here with you for this, your state conference. Well, I have been traveling around for the last 2 days and hardly, and so privileged to make it with you here. Right now, the next 20 minutes, we'll be going through some random thoughts on the child health in the COVID as well as the post-COVID era. Well, friends, it is not a time to say post-COVID. We are still in the COVID era, but hopefully, maybe some few months down the line, we'll be in the post-COVID era. So we have certain challenges, or well, we need to look back and retrospect on what we had in the 1.5 years from 2020 March onwards, the last 2 years, where we stood at with the child health of this country. So what the virus itself, we have got two concerns. One was the virus itself, and you know the containment, the measures, the impact of the containment measures and the long-term measures it had on our children. And as you all can make out, the virus itself didn't have much to take from the children, for the child. It may have some low, maybe the incidence has been much higher in the second wave or so-called third wave, but we didn't have much mortality. The children were not handicapped that much by the virus itself. Most of them were asymptomatic or maybe some mildly symptomatic. But what hurt us more than the virus was the indirect effects. The containment measures we had and the long-term measures on that perspective did harm our children. And the children, we had on many aspects, the nutrition was hampered, the education went to a different level, immunization was hampered, we had many COVID orphans, and the most important, the psychosocial and the mental health issues. The nutrition, of course, on one side, it could be a little bit of malnutrition. I must say it was a small segment, but most importantly, maybe from the middle class or upper middle class, or most of the children, even from the lower income group, they landed in certain amount of obesity. So what exactly, even when the malnutrition, certain governments or certain territories, they came out with their own measures to circumvent the malnutrition associated with the COVID era. And Kerala, here is the Kerala government delivering the midday meals at home. Well, it happened only for a few months and later on it did not take off. But most important, we had the overweight and obesity looming at us from the very beginning. And now, down maybe 1.5 years from the COVID, we face a lot of children with more than around 140% of the expected weight. We had the lack of daily routines. We had a change in sleep routine, length of quarantine, increased screen time, And ultimately did this physical activity coupled with unhealthy diet going on to the, it was in fact taken as a one-way ticket to the global childhood obesity crisis. The General Diabetes has put it in in that easy manner. So it's and another important aspect was apart from nutrition, the physical to virtual platform. We never thought about this virtual platform maybe 2 years back. Well, our own IAP president, Dr. Bakul Parekh in 2020 had a great vision and he thought about the virtual platform. He put us on the DAAP. But our children, they never thought about this. Our parents never conceived such a thought of the virtual platforms in the early time of 2020. So it was a totally different aligned territory for our children. The e-learning that had on its own disadvantages, the online and from the movement from the online, the classrooms where we had a direct eye contact to the online learning platforms. So there was no sense of structure and stimulation provided by school environment, less opportunity to be their friends, and everything is there with the e-learning platform. No face-to-face interactions. You can see even the children, you can see even in the airport, anywhere you go, people will be sitting with their chins down and not realizing what is happening in the next seat or what is happening even with the relatives or friends or whoever is sitting next by. They don't have, everything is there on the tablets or in the mobile phones. Well, we don't have the one, we are moving away from the friends and no physical activity. So no working groups, and that naturally took us to the excess screen time. It was a natural offshoot of that, whatever time they spend on the virtual platforms. So the UNICEF has put it as something around 463 million children worldwide were unable to access remote learning. So well, we were talking about digital learning. Every one of us, our parents, everyone is well aware of the online platforms. But despite all the efforts from the government agencies, then the governments, when the official agencies, some around 463 million children across the globe were not able to access. And you can see somewhere India, South Asia still had around 60%. So something around 40% or the children were not able to access the screen at any time. So you see, but then when we were, before COVID, Indian Academy of Pediatrics, along with most of the pediatricians in the fraternity, were worried about excess screen time in children. That was a time where we are trying to impose screen restrictions on our children. But we are taken aghast by this, the COVID. Well, we had to give them the screen platform. We had to encourage them to come to the screen to learn something, to online platforms. So earlier we used to advise only no screen use for children less than 1 year. This is the ideal one for the AAP recommendations. 2 to 4 year children, 1 hour of screen use, and older children manage screen use. Now we know where we stand now. Even a child at 6 months when he starts crying, he is being shown the tablet. You can see even our pediatric ICUs, when the children start crying, they are shown the tablets and they are shown the mobile phones and they keep quiet. So there is no other way. This has become a part of our life and a part of our system. We should know where we have to stop. And the problems of excessive screen, naturally, it has resulted in the obesity and overweight. Of course, snacking happens alongside with the screen time. It's easily done. Advertisement related eating behavior and eye problems. Whether they are true or not, many children, they come with eye pain, headache, and the visual issues are there, sleep-related problems and mental health issues. So these are all natural issues or the sequelae of excessive screen time. The more challenging issues are there for digital learning, especially for children with the parents of children with educational needs like ADHD, autism, or other learning difficulties. They really had a very tough time. Many of them were, all of you will be having quite a good number of children who have we put them on remedial measures, some amount of rehabilitation where they must be on maybe at the age of 1.5 years. They lost the track. 1.5 years, they're confined to their houses and they totally lost the opportunity for stimulation, opportunity to have some remedial measures or some sort of therapy. The people were not coming out of their houses. So that 1.5 to 2 years, vital 2 years were lost for these children who will be totally lost unless they would have been given some proper attention at remedial therapy at the right time. So that was a challenge. That was a great challenge for the children of parents of children with education, these special needs. And at home, the parents, they found it difficult to manage maybe more than two or maybe two children or even more than that. They can see the mother is on one side, the children on the other side. The working mother finds it difficult on one side to have her own job going on the other side, manage the child with who is on the online classes and working from home at the same time. So this is digital learning had its own charm, but otherwise for a mother or a working parent or a parents with children with special needs, it was a really tough time. And of course, we had a lot of suicides, accidents coming up. Maybe the children learn from the screen, or they don't learn the improper manner, or the screen inspires them to do something which is adventure, or we can even call it as a misadventure. So that has resulted in many incidents. And I had this child that's known to me actually, that the 12-year-old boy dies aping hair strengthening act in Trivandrum. That was a child who was known to me actually, the neighbor of my cousin of myself. So this is a very, very unfortunate situation. These children were quite brilliant in their classes and they were doing quite well. Just because of the COVID, they were stuck to the screen, and then though everything happened, maybe in few months, we lost such children. And effects of online learning, physical problems, psychosocial issues, educational issues, even truancy from virtual class, online teacher bullying, everything is happening. And even psychosomatic complaints. This is a wonderful study from our own, they published in Indian Pediatrics by Utkarsh Bansal, Swati Gatte and others, the parental perspectives on remote learning and school reopening. So it was a wonderful study which highlighted all these issues. Are we really having any real solutions? We are already through it, but then many have tried, many have experienced, and we can set up parental controls, strict privacy settings for online apps and games. Is better said than done. Not that easy. Your child may resist, lot of hesitancy will be there, parents will find it difficult, and they may not be that well-versed, tech-savvy to interfere or to take the child away from that particular apps and games. And if the child is withdrawn or upset or secretive, that happens many a time. He has his own way of doing with the mobile or tablets. He is being a little secretive. That itself may suggest something is going wrong with him. So these are certain solutions. And coming on to the immunizations in the COVID era, this is immunization being our domain, the pediatrician's domain. We had a lot of momentum gained in the immunization from the last 2 decades. We have come to around 90-95% immunization in most of the states. Tamil Nadu has been doing so wonderful and the best. I must congratulate the pediatricians here. You have overtaken Kerala and you have been doing wonderfully well for the last 10 years. So you are really proud about the state of Tamil Nadu and the health model. We talked about Kerala model some maybe 10 years back, but now we need to talk about Tamil Nadu model across the world, I believe. Maybe some in the infant statistics, we may be little better in the IMR and others, but otherwise, when the way you have picked up the pace in the last 10 years, that is amazing. The way you have gone ahead on the health platforms. So I mean, immunization, we got lost in the last few years. Maybe 2 years, the health-seeking behavior of the people have changed. They were really, even from the advisory from the government of India was there. Children below 10 years, don't take them outside, don't go out, don't move out. So parents, maybe for 2 years, for a few months, they were really obliging. And even afterwards, we found it difficult to convince them, you come out and have their immunization. Then the primary focus of public health was focused towards the containment of COVID-19. And that may be more prone for the vaccine preventable diseases. So immunization, whatever momentum we had gained in the last 2 decades was hurt a little bit through by the COVID. And WHO and UNICEF one of a decline in the immunizations at that moment. And we had a timely intervention from IAP in that period itself. The immunization, we had a good study from our ACVAP team, Dr. Srinivas Kashi, and the team from ACVAP. They had done a good study on that. The recommendations were put it in the Indian Pediatrics. What exactly we have to move around with the immunization of the children in COVID times. This is the most important aspect of COVID, the psychosocial impact of COVID. You can see the child kneeling down. A lot of literature is there. Elsevier has published this, and even Dr. Begul Parekh and Dr. Samir Dalwai have put it as there's a good study in Indian Academy of Pediatrics from 2020, the psychosocial impact of COVID-19 pandemic in children. So a lot of publications are there. The gravity of the problem lies in the negatively affected behavior. Some anxiety, some 35%, depression, irritability. Inattention, even the significant fear of COVID was there in 22.5%, and boredom and sleep disturbance was there in many children. So the gravity of the problem was enormous. You can note down anything easier than.
Overall, you appreciated Tamil Nadu, but these people have put on so much of it. Pondicherry people are taking the responsibility.
Yeah.
That's okay.
You can see that all these psychosocial issues are there, the changing dependent behavior, and even the fears are even manifested. The instance of the dark, for instance, the fear of the dark and decreased interest in praying. Children have been worried about COVID itself. And mental health issues, staying at home and spending more time, psychosocial issues are there, and even anecdotal reports of increased domestic violence and abuse have been there. Many reports are there. You can you can see, and then behavioral changes are there. Social isolation, the frustration, anger, anxiety, irritation, everything has led to so much of behavioral changes. The disconnection from school and loss of enthusiasm, the lack of competitive zone is there. You can see that the domestic violence has been in a good number. There are reports, but then these are not substantiated well. The studies have been conflicting whether COVID has given rise to more of domestic violence or not. But as a logical conclusion, we can believe that COVID has given rise to be more of domestic violence in that last 2 years. And whether we have got any remedial measures for it, could be these are certain suggestions of proper parenting. Of course, proper parenting stands tall in to address any issues. Clear, direct, open and detailed information about the disease, even about the COVID. Many children come to the OPD, and even our 2-year-old child is afraid to remove the mask. He is worried about the COVID, and he is worried about the fear of death. Somebody has told him that if you don't use the mask, you will land, you will not be in this world. So he is worried, and I have a child. Every time his mother says even inside the house, he is wearing the mask. Maybe 2.5 to 3-year-old child. He is worried about, the fear of death is for him. So he is worried about COVID. So that much negative impact has been shared with the children. So we are clear understanding and clear information to be given about the disease and in precautionary measures. The sleep cycle. I mean, you've seen, most of you have experienced that your children must have been sleeping late at night, maybe 2 o'clock or 3 o'clock. So physical exercise schedule and a lot of measures are suggested. Well, of course, how far these are feasible is to be practiced by every family. And this is something important. Impact on differently able children. They are the hidden victims. They are more affected by measures to control the disease than the infection per se, because they have been not the opportunity to go out, or they have not the opportunity to have the exposed to the peer group, and lack of provision of education, nutritional and healthcare services. Other children can cope up or then catch up with these maybe lost months or lost years, where any normally growing child can catch up with that. But a differently able child, well, we have to take up the remedial measures from the very beginning. So COVID orphans, as per WHO, around 115 lakh children lost a parent to COVID, including 1.2 lakh in India. So it's an enormous number compared to any other disease. So this is something which has happened in the last 1.5 years only. Preventing another wave, we need to look at it. And COVID vaccines, of course, it's another topic by itself to discuss. Already in use, we have the Pfizer and the Moderna. And protective pediatric vaccines are available. Then that's now we think about, we are a time when we are looking at the back to school. Whether the phased reopening, rotating schedules, hybrid learning, physical and virtual sessions. So now I believe almost all the states have got at least 50% of the children, or as per a study in Kerala, there's some 30% of the children are back to schools, and around 60% of the parents are willing to send their children to school. So really, even Indian Academy of Pediatrics has released in guidelines in 2020 itself, interim guidelines on school reopening. And to recap, mainly indirect effects of containment. More than the virus, it was the indirect effects of containment measures which was more distressing for the children. Nutrition side, obesity and overweight, and digital learning, negative impact on overall growth and development, the loss of stimulation and social contact, excess screen time on one side, psychosocial impact, mental health and behavioral issues, and more so with the differently able children, and routine immunization was adversely affected. Now we are in the post-COVID, hopefully in the post-COVID era, or back slowly limping back to the golden days, maybe in the 1990 and early 1920, back to school, and we are a staggered opening happening in almost every state. Even Punjab has got around 70% of the children going to school right now. So that's a time when we are looking forward to almost all our children going back to school by maybe at the next academic year itself. Let's build a fairer, healthier world for everyone, especially for the children whom we are the custodians and we really need to be worried about. Thank you very much. And I must really again congratulate TNSC, especially President Dr. Ismail, Secretary Rajendran, Treasurer Dr. Sarin, as well as the organizing secretary here, Dr. Sendil, as well as the other Rajendran, as well as all my dear, the passionate IAPNs in Pondicherry, Dr. Srinivasan sir, and all those stalwarts in JIPMER and the Pondicherry institutes for making it happen. And I'm so happy that all my dear friends are here, Dr. Yoga, including Dr. Yoganathan. He is my for activities when I was the secretary of the Central IAP. And we look forward to an interesting post-COVID year. And the Central IAP team is very much there with you, myself at the helm, and 2022, taking back children to the school and taking back all our IAPNs to the schools. Well, these are our physical platforms. And I'm so proud that I'm so happy to hear that we have